Hi, welcome back to Dr. Kang's scuba diving stories. Today I want to talk about the recovery position. Divers, when we go up to the level of a rescue diver, we must take CPR, first aid, AED, and if you go for professional level, you also take oxygen provider. Recovery position is learned and practiced in all CPR and first aid course. But there is something a little more than that in scuba diving. But as far as I see, as far as I've been teaching, this part has not been included in recreational diving CPR first aid part. So I like to include the diving part of recovery position as well. First, we will see some history and the recovery position, what is it? And then why we put the patient in recovery position. Do we lie the patient down on the right or left? And also I will talk about the cerebral arterial gas embolism and the related recovery position. First, a brief look at history. It was in 1891, Dr. Robert Bowles from England, he first suggested to put the patient on the left side down position to prevent choking, which made very good sense. But after many years, in 1938, British Red Cross First Aid Manual, they put this sentence in the book. Place the head in such a position that the windpipe is kept straight, keeping the head up if the face is flushed, and in line with body if it is pale. It's specifically telling us how to put the patient with what position. And after that, in 1950, St. John, again the English hospital with a very good reputation on first aid, they wrote the manual and it says, if breathing is noisy, turn the patient into 3/4 prone position. It's not exactly lateral position, 3/4 prone position, which is pretty similar to modern recovery position. But only in 1992, AHA, American Heart Association, they accept or adopt the recovery position. In 92, European Resuscitation Council, they suggested the arm should be straightened out instead of like this to prevent the additional damage to nerve and vessels, sometimes even muscles. So this again is mutating, and there's one principle that all recovery position have to abide by. That's in 1969, International Liaison Committee on Resuscitation. They suggested the basic principles for recovery position, which goes near true lateral position with head down. This one is not kept very well except in diving accident. Position should be stable, so somehow lock your legs with the other leg. No pressure on the chest. That's about the difficulty in breathing. Easy position change. You have to be readily be able to change the position, and also we should be able to observe and access the victim's airway. position should never give additional damage to the victim. It's mostly about vessels and nerves. There are many positions used in hospital for patients, and upright, prone, supine, lateral, Fowler, Trendelenburg, many more. The positions in the hospital, if it is in the world, they usually follow these very well-known positions. But in the surgical room, in operating room, doctors decide the best position they can do the operation without damaging the patient. And so how we take, what is it and how, why? Recovery position is one of the series of variations on a lateral recumbent or three-quarter prone position of the body. This position is for unconscious but breathing patient. To prevent airway obstruction by tongue, by vomitus, or any fluid from regurgitation as well. It also prevents aspiration pneumonia. So Glasgow Coma scale, that's something that doctors use to evaluate coma patient. And it's called the Glasgow Coma scale. And this is the home page. And here we see I speaking and the mobility. So we put 6 different scales on each item. So altogether it will be like 18. Any patient higher than 15 is okay, very healthy maybe. Any patient with 8 or below, they need recovery position. This is the hospital way of deciding who to put in recovery position. So how we do it, this is a later classical thing. Put on the lateral position, and it used to be like left, arm supporting head, the arm on the downside, and other hand also either supporting the head or put it on the other arm. Leg straighten out, the one on the downside, and the other leg flexed at the knee. So this is pretty classical. Now the recovery position has a little changed. It's however you put, the principle is the same. Mouth has to be downward so that the fluid can drain out. Chin has to be up to open airway. This is epiglottis, and arms and legs should be locked so that the victim can be stabilized. So this is the recovery position in general. Now the story goes to why right side, why left side. If you Google the recovery position, you see many cartoons or pictures, and this one shows left side, this one shows right side, and this one also shows left side. Many people still think it's left side down on the lateral position, but it came mostly likely from the ambulance. Like in America, in Korea, we have a wheel on the left side, and also the beds goes to the left side, and medics, paramedics, nurses, in order to be able to observe and help the patient has to lie on their left side. So that's where the left side came from, I think. But like this one, the bed is on the right side, and I believe the driver's wheel is also on the right side. So right side, left side doesn't really matter. But in diving, it's a different story. So I will tell you what that different story is. Cage, it's a cerebral arterial gas embolism. If you have arterial gas embolism, particularly in the head, you have to put the patient on the left side with head down, so that we can keep the bubbles on the upper wall of left atrium. Let's see the possible symptom of cage first. People begin to feel dizzy, confused. Some people show the personality change, but eventually, if you have embolism on your head, there will be some paralysis. And then you lose your consciousness, and it can be lethal. So why put on the left side and head down? This is the head. This is the heart. And when you are up straight, or when we lie down, venous blood coming here, down here, goes to the lungs, and then it comes back to left atrium, goes down to the left ventricle. If we have bubbles, the bubbles will find its way very easily to go down to the left ventricle, and then goes to the arterial circulation, and then to the head. So we put the patient on the left side, so the heart goes this way. Hope you can see this. So when arterial blood comes back here, the blood that has bubbles should be accumulated here, and here's the valve. So we try whatever we can do to delay the bubbles going into the systemic circulation, and also to put by putting the head down, whatever bubbles which find its way to the systemic circulation will go around, and then will bypass the carotid artery, because the head is down, and we try to protect the head. We try to protect the brain from being blocked by arterial gas embolism. So this is a very important part of recovery position for divers. If you find any diver after diving with suspected symptoms of cage, you have to put the patient on the left side with head down and immediately evacuate to the hospital, possibly with hyperbaric chamber. So today I talked about a recovery position, and I hope this can help someone in any near future. So this is about recovery position, and thank you very much for listening. I'll be back.